The pelvis is a critical region of the body, providing support for the weight of our body, facilitating movement, and protecting key structures such as the reproductive organs, bladder, and rectum. The anatomy of the pelvic region is complex, involving numerous muscles, ligaments, and neurovascular structures that work in concert to allow for various functions, from walking to childbirth. In this video, we'll dive deep into the muscles, ligaments, and neurovascular structures of the pelvis, exploring their anatomy and clinical relevance. Pelvic bones and the bony structure of the pelvis. Before we dive into the muscles, ligaments, and nerves, it's important to understand the basic bony structure of the pelvis. The pelvic girdle is composed of the ilium, ischium, pubis, and the sacrum, all of which fuse together to form the pelvic ring. The pelvis can be divided into two regions: greater or false pelvis, the area above the pelvic brim, which supports the abdominal organs; lesser or true pelvis, the region below the pelvic brim, which contains the pelvic organs. Now let's take a closer look at the muscles that help provide movement and stability within the pelvis. Pelvic muscles. The muscles of the pelvic region can be categorized into two main groups: muscles of the pelvic floor and muscles of the pelvis itself. These muscles serve to support pelvic organs, assist in movement, and play a critical role in functions like urination, defecation, and childbirth. 1. Pelvic floor muscles. The pelvic floor consists of muscles that form a hammock-like structure at the base of the pelvis, supporting organs such as the bladder, uterus, and rectum. Key muscles in this group include levator ani. This is the most important muscle group in the pelvic floor, consisting of the pubococcygeus, iliococcygeus, and puborectalis muscles. Coccygeus. This muscle provides additional support to the pelvic floor and helps with the movement of the coccyx. These muscles are vital for maintaining continence and aiding in childbirth, as they allow for the controlled release of urine and feces. Weakness or dysfunction in these muscles can result in conditions such as pelvic organ prolapse, urinary incontinence, or fecal incontinence. 2. Pelvic muscles involved in movement. The muscles that are responsible for the movement of the pelvis and surrounding structures include piriformis, a key muscle in the posterior pelvic region, responsible for lateral rotation and abduction of the hip; obturator internus, a muscle that aids in the rotation and stabilization of the hip joint. These muscles also provide strength and support for the hip joint and lower limbs, contributing to walking, running, and other activities. Let's move on to the ligaments that provide stability to the pelvic region. Pelvic ligaments, structure and role. The ligaments of the pelvis provide critical support to maintain the integrity of the pelvic cavity and ensure stability during movement. These ligaments also help in transferring forces from the lower limbs to the trunk. Major ligaments of the pelvic region include sacroiliac ligaments. These ligaments connect the sacrum to the ilium and play a significant role in stabilizing the sacroiliac joint. They prevent excessive movement between the sacrum and ilium, which is essential for maintaining the strength of the pelvic ring. Pubic symphysis. This is a cartilaginous joint that connects the two pubic bones. It provides slight movement between the bones, allowing for some flexibility during activities like walking or childbirth. Round ligament of the uterus. In females, the round ligament connects the uterus to the anterior pelvic wall. This ligament provides support to the uterus during pregnancy, and stretching of this ligament is often a source of pain during pregnancy. Uterosacral ligaments. These ligaments support the uterus and hold it in place within the pelvis. They are particularly important for maintaining the positioning of the uterus in a non-pregnant state. Now let's take a closer look at the neurovascular structures that are crucial for the function of the pelvic region. Neurovascular structures of the pelvis. The pelvis is richly supplied with nerves, arteries, and veins that support both motor and sensory functions in the pelvic region and lower limbs. Key neurovascular structures include pelvic nerves. The sacral and coccygeal nerves contribute to the pelvic plexus, which innervates the pelvic organs. These nerves are involved in functions such as bladder control, sexual function, and defecation. For example, the pudendal nerve is crucial for the motor control of the pelvic floor muscles and sensation in the genital area. Arteries and veins. The internal iliac artery is the main blood supply to the pelvis and branches into numerous smaller arteries that supply the pelvic organs. The veins of the pelvis drain into the internal iliac veins, which ultimately drain into the inferior vena cava. Let's now move on to the clinical relevance of pelvic anatomy. Clinical correlation. Let's explore a few conditions that are directly related to pelvic anatomy. Pelvic organ prolapse. This occurs when the pelvic floor muscles weaken and fail to support the pelvic organs properly. This leads to the descent of the bladder, uterus, or rectum into the vaginal canal. Common symptoms include pelvic pressure, urinary incontinence, and vaginal bulging. Pelvic floor rehabilitation or surgical interventions may be needed for treatment. Pelvic fractures. Pelvic fractures are often caused by trauma such as car accidents or falls. These fractures can affect the stability of the pelvis and may damage the neurovascular structures. In severe cases, surgery may be required to stabilize the pelvic bones and prevent complications like hemorrhage or nerve damage. Urinary incontinence, dysfunction of the pelvic floor muscles, often due to injury or aging, can lead to urinary incontinence. Pelvic floor exercises, biofeedback, or surgical interventions may be required to manage this condition effectively. Endometriosis. In this condition, tissue similar to the uterine lining grows outside the uterus, often on the pelvic organs. This can lead to pain, infertility, and other complications. Understanding the pelvic anatomy is crucial for accurate diagnosis and effective treatment, which may involve surgery or hormone therapy. Pelvic pain syndromes. Chronic pelvic pain, often caused by disorders like interstitial cystitis or pelvic inflammatory disease, can be debilitating. Understanding the intricate relationships between the pelvic muscles, ligaments, and neurovascular structures helps in diagnosing the root causes of pelvic pain. Key concepts. To summarize the key concepts from our exploration of pelvic anatomy. Pelvic bones. The pelvis provides structural support and houses vital organs. Pelvic muscles. The pelvic floor muscles support the organs and help with bodily functions, while other pelvic muscles contribute to movement and stability. Pelvic ligaments. Ligaments in the pelvic region help stabilize the pelvis and support the organs, including during pregnancy and childbirth. Neurovascular structures. The nerves and blood vessels of the pelvis play a crucial role in the functioning of the pelvic organs. The anatomy of the pelvis, including its muscles, ligaments, and neurovascular structures, is essential for understanding the functions and potential pathologies of this important region. Here's a question for you. A patient presents with chronic pelvic pain and urinary incontinence. Upon examination, the pelvic floor muscles appear weakened. What could be the potential diagnosis and how would you approach treatment? Let me know in the comments below. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain, and eyes, visit my channel to view my other videos.